Just to say that is one of the more prevalent cohorts that we definitely see, and I discussed that earlier. And we can say use condoms, use condoms, use condoms all day long. They love the message, like Michael said. Magnums are a big thing in town with our young people. You give them the magnums. They'll use them. It's like a trend. You got the gold in your purse or in your bag or wherever. But it's the fact of not only using the condoms, but having a message that you deserve to be responsible and that you can be responsibility, because using condoms means you're being a responsible person. And those messages aren't geared towards specifically the MSM community because of the culture that's taught that you're not supposed to be responsible. This expectation that you will have HIV. All these nuances of what comes into play when you're trying to deliver that message. Like a mother might take her daughter to see the doctor. The doctor's going to talk to that daughter about her reproductive health, how she's doing. She's going to make sure she talks about birth control and all of those things so that she can be a responsible girl when she decides that she wants to be sexually active. These conversations are not happening in doctors' offices with gay young people who are engaging in sexual behaviors, and they're just like, oh, we'll just, make sure you put on a condom and do this, do that. But they're not really going into these deep and bred conversations to make that person feel that as an individual, it's okay for me to be able to have a conversation with my partner to say that I care about myself. And so the less that information is being interpreted or received, the more apt that person is to say, it does not matter because I'm supposed to have this happen to me just historically. This is what is supposed to go on. And so, with the research that says that, there was one done in Indiana, and there were so many young people that were tested, and out of those young people that were tested, there were 50 to 60% of them did not believe that they were HIV positive and had practiced all types of unprotected sex, but it just wasn't clicking. And again, I think that happens because, the segmentation and marginalization of a community that has dealt and battled with this disease for so long because people still profile and still feel like, you're going to do drugs or, it's something that's going to be your fault. And so if we stop faulting people for who they are and teach people how to properly and socially have positive social spaces, besides the club, besides, going to dances at things that are positively socially enforcing these rules of engagement that we have to use today, because not only is there HIV, there are other devastating STDs and health disparity issues that can arise from not getting a clear message.
Really quickly, I just wanted to make a point, you haven't said anything yet. So, really quickly, I always, when my friends, my peers, talk to me about condoms, and they do, because they know what I do for a living, I always make one analogy to them. I always say, white woman in Montana. And what that means is that if you wanted to go and have sex with a white woman in Montana, you probably would do it by wearing a condom. Because white women in Montana don't have a lot of HIV. Their pool infection is very low. Now, if you wanted to have sex with a gay man in Washington, D.C., it is off the charts more risky. And if you're a person of color, even more so. And so the point that has to be made, people need to know about the pool of infections and the level of risk that's involved in their community when they're making these decisions not to use condoms for the rest of their lives. Because I agree with you, that's a very high burden, but it's what we have to deal with.
I think the point about the social norms is well taken. Lately there's been a pushback against the idea of people using condoms in porn as a changing the social norms surrounding condom use and intimacy.
Couldn't completely hear you actually. Before you say it again, I just wanted to say one thing in answer to Mr. Goforth's question. So his question is kind of like, what are potential solutions if what we're doing now isn't working? And to me, it's all about multiple options for people. And to give you an example, when you asked about older people, a few months ago, I diagnosed a 73-year-old physician with HIV. And I kind of, after we got through the shock of it all, I kind of asked him why. And he's like, I've been using condoms for so long, I thought just one time it wasn't going to make a difference. And so, but if he knew he had options, things could have been different. So after that one event, if he came in for HIV post-exposure prophylaxis, he'd likely still be negative. If he knew he was, going to have sex with multiple people, even though he was in a relationship, he could have been on pre-exposure prophylaxis. So to me, it's about options for people, because I think different options work for different people, but condoms alone, over the years, they have not been the one solution. And I'm sorry, can you say yours again?
I think if I understood the question correctly, you were talking about some of the, I know that in the news there is some pushback now against porn studios that are putting out movies, bareback movies, and things like that. There's a movement trying to push people to, only one consume porn that models healthy sexual behavior, and to try to get those studios to actually start using condoms again. And is there a role for that, in this discussion? And is there a role in sexual communications, I guess, within the community in terms of modeling that? Is that close enough to what you were?
Can you hear me a little bit better? All right. I'm wondering if there's a role for condoms being used in an explicit sexual setting in the MSM community and how we model and implement prevention messages for MSM.
Well, the DC centers, or just, I don't know if I can say it out loud, the F campaign.
I can say it if you want me to.
I'll say it. It's the Fuck It campaign. Yes, Department of Health official says fuck it out loud. Yes, I think there's a role for multiple messages to reach multiple audiences. We're not a uniform group of people. Some of us would say, oh, that's not something that works for me, whereas for other gay bisexual men, it would work for them. I think we need, as Ray was saying, multiple approaches. And I guess I do think that, what we call in the parlance social determinants of health, but the environment that we're in, that we're beginning to make some changes in society that might actually change some of that picture for gay men. You can get married here in DC. Maryland just passed a marriage that the messages that are always based around, well, you stay abstinent until you get married, because then when you get married you can have all the sex you want. I'm not sure all married people would subscribe to that notion, but that's the whole abstinence theory, is that you're doing that until you have this permanent partner for the rest of your life. Well, I think that gay men can, or young gay men can now start to aspire to that. We don't have to have a notion that our relationships are always transient, or our relationships are always temporary, and that we can make legal partnerships among us. Changing some of that picture helps to reinforce that there are things to aspire to. I do think that, unfortunately, most of our messages, we don't have a lot of aspiring messages for gay men. Traditionally, most of the messages around public health have been, if you don't do this, you're going to die. That's not really a very aspiring message, and I think we do need to be able to craft messages that give people that direction, and that there could be that scenario that is, in your relationship, you have reached the understanding of your relationship actually twice a year for gay men. You get tested, and you may not need to use condoms in your relationship. If your relationship includes other people, that in that other people dimension, you use condoms. You know, I also use or as my former boss, Shannon Hader, always used to pick on North Dakota. I was picking on Montana. In terms of its prevalence rate, which was like 0.1%, as opposed to our prevalence rate, which is 3% among our all population, and somewhere between 15 and maybe 30% among gay men in the District of Columbia. That's a staggering number. So not using condoms with a partner whose status you don't know is even once a significant risk. But if you are in that relationship, why not? I mean, this is, so that message of you have to wear condoms for the rest of you, to use them for the rest of your life, I'm not sure, and I'm not, as the public health department, we're about trying to reduce transmission. That is our goal. So if you have two people who are HIV negative, they're not going to transmit to each other. So we need to be able to give people the right strategies and approaches and keep them informed about it, and then also make it in an aspiring way, because I think negative messages just don't work.
Actually.